Good morning, everybody. According to the official timekeeping system of the United States of America, my Verizon Apple cell phone, exactly 10 o'clock Eastern. This Social Security Open Forum is brought to you by the National Social Security Advisor Certificate Program, where we provide a whole bunch of really good training. That's me, Jim, and of course, Harold. After education is over, advisors earn our certificate, joining 2,700 folks across the country that have earned our certificate so far. Thanks everybody for joining us today. It's an exciting time here. The first pitch for the Cincinnati Reds, I think, is Thursday. So I think a lot of teams start on Thursday. I think my Cleveland Indians will. And Jim, the Reds do, right? So they start Thursday.
Yeah, it's Thursday.
If you're all excited about, hope springs eternal during spring exhibition time. So if you think your team is going to win the World Series this year, just give me a thumbs up. Come on. Like I said, hope springs eternal during the preseason time. I think the Reds are going to do good, pretty good. I predict 90 victories. Indians, who knows? New coach, not lots of new players. Maybe they can score some runs. Anyway, you all know what's going on. You raise your hand if you want to be called on first. But I'm gonna go to Marcia Mantell first. Marcia and I were trading emails. I was in a UDF on Saturday waiting for my exercise guy to get to his office, and I came across an article about Medicare Advantage plans. And since we talk about Medicare in our class, I wanted to read it. And there we had Marcia Mantell being interviewed in the first paragraph of that article. I was excited about that. Marcia also indicated to me that she does a lot of writing. So I wanted to have Marcia talk about her activities and how she incorporates that into what she does. Go ahead, Marcia. Thank you for being willing to talk.
Oh, absolutely, Mark. Thank you. And that was very fun to get your note this morning. I often, so a back step. I've been in this industry for 30 years. And so I did all retirement product development and marketing at Fidelity for the first 13. And the last 19, I've had my own consulting company. And there are a number of ways you can build a company. One is you can do traditional sales, you do cold calling, you do, traditional sales type activities, or you can do some marketing. For me, I found that it was networking was the most important part to this long time having a business. And part of that networking, I ended up meeting a number of journalists. And I also have a colleague who's an editor at Retirement Daily on the Street, which is the Jim Cramer organization. And so I was asked, would I be willing to contribute some articles? And what started out as an occasional article has turned into I'm a gerbil on a spinning wheel most months trying to hit the deadlines. So I do write a tremendous amount about Social Security first and foremost, and I always have the NSSA designation next to my name and in the little block about my who I am. And then so Retirement Daily is for consumers. And on the professional side, I write for Think Advisor. I have a column called Connecting the Dots, and I write for them 6 to 8 times a year, and Life and Health Advisor. But also I've been approached by many journalists, and this latest one was in Barron's. So it's a really big deal. Mostly I'm more local. I think a lot of us get local press and such, but when the big guys come calling, man, I drop everything to be interviewed. So yeah, it was pretty exciting to get this invitation by Elizabeth O'Brien, and it turned out to be the cover story on Barron's.
Oh, was it?
Yeah.
Okay.
Which I didn't know at first, and I got my actual publication on Saturday, and we look at it, open it up, and it's like, oh my God, there's a Medicare Advantage conversation on the cover, and sure enough, that's the article.
Oh, very good. So, and your name was
listed.
Your name was in the first paragraph, I believe, right, Marcia?
It was the first 2 words for Marcia Mantell. I almost fell off my chair. So you never know. when
So,
working with
Marcia, what
reporters.
are your thoughts about Advantage plans? Because the article is not extremely positive.
It was not positive, but I think she did an extremely good and thorough job of painting bits about all of the issues in the health insurance industry these days. Um, my personal belief, not selling insurance, but I have an insurance license also,
Okay.
is we all have to have insurance, full stop, health insurance. We can't make it without it. And then you need to understand what you're buying. So Medicare Advantage plans operate and are structured one way. Medigap plans are structured a very different way. And if you don't understand what you're buying, do your homework.
And and that's my fear. And everyone can chime in, of course, but I see all these commercials on TV, Shatner and who knows, Jimmy
JJ
Fox.
Walker.
Yeah,
Yeah.
JJ, yeah. And they're all promoting, of course, and you call the toll-free number to find out what's available in your area. And more than half of the Medicare beneficiaries are in Medicare Advantage plans. And like Marcia said, and I do agree with you, they don't know what they're in. They just said, yes, it sounds good to me. Let's sign up. And then to go from Medicare Advantage back to A and B, original Medicare, that's difficult to do because there's underwriting involved. And according to an article I read, maybe the one you're in, 2% of policy, 2% of beneficiaries, I think last year were able to go from Advantage to original Medicare. Maybe not your article, but maybe another one. It's only 2%. It's not many.
It's not many. No insurance. We're all business people. No one wants you when you're 85 and you've had 2 heart attacks.
Mm-hmm.
And now you want to go to the maximum flexibility plan. You haven't paid your way.
Mm-hmm.
So I get it from the insurance side, but the
Yeah.
consumer doesn't
Yeah.
understand that.
I'm
Or
not
how the
trying. Yeah.
commissions work. That's the
I
other thing
have a question.
we have to ask
I
that
didn't think
question.
that there was,
Go ahead,
I didn't
Allison.
think that was an issue of going back to A and B. There's an issue of going to a Medicare supplement, but they can go back to A and B anytime without underwriting, right?
Allison, you're right. Yeah, I'm sorry. The supplement. You got
Oh, yes, the supplement's definitely an issue for underwriting later.
Underwriting.
But people don't understand that. And I also think that, what they do is they say, oh, 0 premium, or it's either super cheap. And the good news is you're going to get a gym membership, and dental's included. Like, they have these big sales pitches, and it sounds fantastic to somebody that's on a fixed income, but they don't know until it's a lot of times too late. I think it's a real issue.
And some of those freebies, I understand, might be going away. I mean, that's the cost. Medicare costs, medical costs are rising for these insurance companies, so they have to, increase their Advantage premiums, or maybe reduce coverage, or reduce some of those freebies. I have a question for folks. I'm currently on Medical Mutual's Medigap. Can I transfer easily to United Healthcare to another Medigap policy, or do I need to go through underwriting?
Underwriting when you're changing companies.
Even from one Medigap to
Definitely.
another?
Yeah, because again, think about it from the insurance, the insurance provider, so the insurance company's perspective. You've been, say, for 5 years in one company's paying in. You haven't been paying into my company. So why do I want you 5 years later?
I get
so,
it.
I mean,
Yeah.
But what I would say is I have found the underwriting isn't terrible. I have found that the underwriting isn't terrible. I mean, obviously, if you have uncontrolled diabetes, or serious, you got type 1 diabetes, you got some serious health issues, but if you have the run of the mill, high blood pressure, high cholesterol, underactive thyroid, things like that, or even good control with diabetes, I've seen them do the switch. It's the people that have the laundry list of 15 medications and the marginal control, or maybe not med compliant, that are going to get denied on the switchover.
I don't have 15 medications, probably more like 7. Our marketing director went with an ARP policy, which is offered by United Healthcare. And her premium is lower than others available in this area. So I just wondered, I'll talk to my Medicare guy and see how much my premium would be by switch, Okay.
I think when people are younger switching, you could save money every year because those Medigap policies go up as long as a person's healthy. Switching, every year, it could be beneficial financially, but it's the later years or failing health that becomes an impossible feat.
Then let me ask one more. I know this is Social Security open forum, but we do get questions on Medicare. So another question that I have is this. My prescription drug company, WellCare, they don't charge me a premium. How do they make
this
money?
year?
This year?
This year. Me. So I do a lot of drug analysis also, and it's only this year, 2024. It'll be interesting to see what they do in 2025. And they're making a big play is all they're doing. They made a strategic decision to eliminate, or it's 50 cents here in Massachusetts per month. So to go this really, really ridiculously low
50 cents. Okay.
Yeah, to get everybody in, or lots more people in this year, because people tend to not change once they're in. And so they're banking on that.
I see.
Yeah,
so
it was very interesting.
So last year I paid $125 for the whole year. And then of course they sent me a text saying there's not going to be any premium. Well, I thought it was a spam text,
Yeah.
But it turned out that's right. So in other words, it's a loss leader. They want to get more people in. They want you to stay. And next year they'll charge something. Okay.
Yeah, that's my guess. And that's because next year the $2,000 cap starting January 2025. So all seniors will be capped at their premium plus drug costs at $2,000.
Oh, that's gonna be nice.
Yeah, I think it's worth it to shop the drug plans because I see huge variance in premiums and out-of-pocket costs and drugs going in and out of, preferred. And they're not going to deny you. So even if your drugs have, gotten, you have a lot more drugs, you can switch your drug plan. But a lot of people don't know that they could switch their drug plan. So they could be saving thousands of dollars a year just by checking that once a year. I think it's worth it to check.
Of course, I'm assuming my Medicare consultant does that for me. Better ask.
I wouldn't assume anything.
I said I better ask.
I would not assume that. I mean, it's easier for your Medicare consultant for you to just stay where you are. So I definitely wouldn't assume.
Okay. All right. Well, thank you. Marcia, have you ever thought about white labeling some of what you write for advisors and selling it?
Some people have suggested that, licensing it, but I honestly just don't know how to go about doing that.
Okay,
but I need to probably think about that a little more.
Yeah, somebody might be willing to pay you $100 a month for the articles you write and put it under their names. I would.
Yeah.
Be happy to. I don't like to
write a lot, and I don't get paid for all these, the big guys.
So
but,
you think about it, because that'd be of interest to me to get your articles, send it out under my name and Jim's name, or company name, Jim. Sorry. And
I thought you were going to pay her $100.
No, the company will, Jim. Company will, buddy.
I see.
Me and Tucker will.
Yeah.
Harold. So anyway, think about it, Marcia, because I would take advantage of that.
Thank you. I will absolutely think about that.
All right. This is called Social Security Open Forum. So let's talk about Social Security now. All right. So if you have a question and you want to raise your hand, you go to the top. You'll replace Teresa, who's my top left. Otherwise, I will start with Teresa and we'll go around the table. Teresa, you're up.
I've got nothing today. Just listening in. Thank you.
Okay, Teresa. Thank you. Marcia, you raised your hand. Go for it.
I actually do have. I came prepared with a question also for you and Jim.
Okay.
And it's about the lead, generating a lead or establishing a lead when a married person applies for Social Security. You connect yourself to your spouse, right? But what happens for an ex-spouse, a divorce situation? There's also a place to indicate that you were married, I believe. And I'm wondering, and the question I got was, does Social Security ever contact the ex-wife in this case when the ex-spousal top-up becomes available? So what happens for these exes?
Yeah, it all depends on how much information the person is able to provide. They do, after you go through and list your current marriage, they do ask you, did you have any other marriages? If you answer yes, the next question is, did it last 10 years or more? Or did it end as a result of the death of your spouse? And if you answer yes to either one of those, then they want the same information. They want their name, social security number, date of birth, date of marriage, date of divorce, that kind of thing. So they want as much information as possible. Now, a lot of people don't know a lot of that information. But it does protect that spouse when they're listed on that application. And what Social Security has to do is they either have to take an application or close out the lead. And by closing out the lead, that means they've tried to contact this person or figure out where they're at. And if they can, they have to contact them. If the person never replies, then they're no longer protected. If they can't find them, any information on them and have no idea of their whereabouts, then they'll just document that, and that closes it out as well. So technically it does protect them, and Social Security does have to take some action. And if the person knows enough, even if they just have their address, Social Security will contact them.
Okay, thank you. But sorry to just tag onto this. A lot of times with the spouse, with the exes, there's one that's 62 first, and you have to wait for the second one to reach 62. Yeah. Is it better as a practice for advisors to encourage clients, when your ex turns 62, you make that proactive phone call back to Social Security so you can get your ex-spousal top up?
Well, yeah, because at that point, it's not Social Security's responsibility, it's the person's. At least that's the Social Security perspective. So if you file for benefits and you list your ex-spouse and they're not 62 yet, that's not a lead. You're not protected. So if a year later they become 62, your initial application didn't protect you. However, deemed filing might apply in that case, because if you're then eligible on their work record, deemed filing would say, now you have to take that benefit. So they might be protected from that perspective, but still be proactive, contact Social Security and then have them check.
Right. Thank you.
Thank you. Richard, are you there, Richard?
I'm here.
Okay, hey, go for it.
I just wanted to mention that I'm a student of Tom Hegna. I got his Social Security book.
Yep.
And I noticed it was co-authored by a gentleman that I know very well. So
yeah. Thanks. Yeah, by me. I didn't co-author it. I just reviewed it and he gave me some credits.
Oh, review, yeah. Okay.
Yeah, I reviewed it, yeah. Yeah, I go ahead, Richard.
Anyways, I wanted to give you a little plug there, Mark.
Thank you. Yeah.
But
yeah,
the other thing is that there was an interview with the new Social Security commissioner.
Yep.
And he said that he is promising to take care of these pullbacks and overpayments and benefit.
Mm-hmm.
So hopefully, that something is going to be done about that to clean that up.
Yeah, he said he put together like a four-pronged approach to taking care of overpayments. Don't ask me what those four prongs are, but he came out. I get blogs from it. You folks may want to do this. Go to SSA.gov and request their blogs, and they'll send you whenever a new document comes out. They'll send it to you. And so recently he came out, talked about the fact that there's a whole bunch of overpayments out there that just aren't being collected. So I put together a four-pronged approach to kind of get that money in. I don't offhand, I know.
And just so you know,
yeah, go ahead.
They all do that. They all say the same thing.
Mm.
People at the Social Security office here, blah, 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 overpayments, blah, blah, blah. We're going to reduce overpayments. And nothing's ever done. They try, but it happens. It's a lot of people filing for benefits, a lot of different angles to it. There's always going to be overpayments. But he'll try. I'll give him the credit, I suppose.
I
but-
think 8 million people applied for Social Security in 2023. 8 million. 66 million people receive a benefit. It's a lot of people.
Yeah, so even if it's a small
Yeah.
percentage of people that are overpaid, it can still be a lot of people and be a lot of money.
All right. Thank you. Thanks, Richard. Cynthia.
I have nothing today.
Nothing. Okay,
Speak.
that's fine.
Okay.
Victoria.
Yeah, hi, how are you?
We're good. Thanks for being here.
Thanks. I have two small questions. May I ask two?
Sure.
Okay. The first one's pretty basic, and you might say I should know this, and I apologize. If I have a couple, they're both waiting till the age of 70 to turn on their Social Security. All right. One is a lower earning spouse, and her PIA would have originally been less than half of his PIA or vice versa.
She should not wait to age 70.
Okay, that's what I'm
Yeah.
saying. At that point,
Let
If
me
he's waiting to-
let me
if
tell
he's
you why
waiting
though.
age- Pardon?
Just quickly, let me tell you why. For all of the DRC she earns, that decreases the spousal boost, dollar for dollar.
right.
So, okay, go ahead now.
Okay, no, that makes sense. But if they're sitting there saying, or if somebody has waited
Mm-hmm.
and they would have been entitled to a spousal boost, if they've waited till 70 and it's past that, does she still or he still receive any kind of spousal boost if they have waited beyond that age 70? I know it sounds like a dumb question, but
Well, you're always eligible for the spousal boost. You
Yeah,
can,
okay.
you can, if both spouses apply at age 80,
okay,
you get that spousal boost. You can go back 6 months as long as the other spouse goes back 6 months too.
yeah. And that would have been based on half of his PIA or her
Yeah.
PIA.
Yeah, both
Just with the
PIAs.
COLA rolled up. Okay, thanks. All right. And then the other question, I have a number of people right now who have disabled children, and the parents are now getting ready to start turning on their own Social Security, which is their child will now receive the DAC benefit. And a lot of them in the area I live in, they like to travel internationally now that they're retiring. Is there a limit? I know when they had a disabled child, they said there was a limit as to how long they could actually leave the country, or maybe it's a month or a period of time. Does that apply also with disability or with DAC benefit? Like, can they live in Europe for half a year at a time, or will the child stop receiving that benefit?
If they're US citizens, they're fine. They'll still there's no limit.
So Social Security doesn't have a limit on the number of
They-
months you can be out of the country at one time to receive the disability benefit or the DAC benefit. It
Not for
matters for the
citizens.
kids.
Yeah, if they're
No.
US citizens, there's no limit. There are countries where you can't receive a payment.
Okay.
They're probably not going to live there, like Cuba, North Korea,
Yeah,
Iran.
but France or London or something
Yeah,
like.
and if it's a country that the United States has a totalization agreement with, and there's 28, I believe, that we do, then even the non-citizens don't have the 6-month limitation.
Okay. All right. So the 6-month limitation, that had to do with just the children, that when the child was younger and receiving a
Right.
disability.
No, it's just non-citizens.
Okay. All right.
I
If
think
the
I'll have to get back
there's
and double check
something
that.
towards when they're receiving SSI. So you can't receive SSI out of
Yeah.
the country. But that's different for the DAC, or what's called childhood disability benefits now. But I just wanted to mention one thing. I have mentioned this on here before, but because all we do is work with special needs. One thing that I think is very, very important is the strategy of turning on benefits for the parents. Because of 1619B and the Pickle Amendment and things like that, it's really, really important for the kid to qualify for SSI and Medicaid first. So that way, when they move over to the childhood disability benefits, they'll be able to keep Medicaid. If they do it backwards and the parent's amount is too high, if the parents claim first and they qualify as a DAC or childhood disability benefits first, then they may be forever disentitled to Medicaid. So it's really, really important. I just wanted to mention that because we've seen some real train wrecks with that.
Wow. Thank you. Yeah. These kids are already they've been on disability since they're infants. So 2-3 years of age. Thank you so much. Thank you very much.
Thank you, everybody. I want to repeat something I said about 5 minutes ago relating to the a lower earning spouse, let's assume it's the wife, don't shoot me. If she waits beyond full retirement age and earns DRCs, for every dollar additional in for DRCs in her benefit, her spousal boost will go down dollar for dollar.
Thank
So
you very
there's
much.
no reason for a lower earning spouse that's expecting a spousal boost to wait beyond full retirement age, because they won't be rewarded. Jim, do you want to add to that?
Thank you.
Yeah, I mean, that's absolutely correct. You know, we normally say you take the higher earners PIA, divide it in half and subtract the lower earners PIA. But technically you subtract the lower earners PIA plus any delayed retirement credits that they've earned. And you know, even if they're going to end up with more money because they waited till 70, now their own benefit is higher than half of their spouses. Usually it's not that much higher. And so they're still not really gaining a whole lot by waiting till age 70. So we always look real hard at when we're looking at a spousal benefit. Is that payable? Is it close? And make sure that they know, don't wait past full retirement age to file for their benefit.
Okay, thank you,
Thank you
Jim.
so very much.
You're
Thank you
welcome.
so much.
So, Caroline, I guess you're next. Caroline's phone. Do you want to say anything?
Hello.
Hi.
Good morning, everyone. I don't have any questions, but I think what you guys are going over today is very good questions and very good nuggets. Thank you.
Pleasure. Thank you, Caroline. Luke. Hi, Luke. Luke,
Hi, guys.
everything in your office is color coordinated, all gray.
I know, yeah, it's kind of one of those. Yeah, we just finished remodeling our office.
But not your hair.
Yeah, nope, not my hair.
Yeah.
Yeah, good.
Okay, go
Working
ahead.
with Social
Yeah.
Security will turn it gray.
Looking forward to that. No questions for me. I had one, but I kind of answered it myself. I went to the slides, and it was because I had gotten a question earlier over last week about a client of someone else who had income from rental properties and if
Okay.
that counted against him or not for the earnings test. So I think it matters if he's using that rental property income like for his business, right? Because I see here that it's Social Security covered wages, non-Social Security
Yeah.
covered wages, then self-employment. So
Yeah.
it kind of matters how he's so you can receive income from rental properties and still have it count against you if that's
Well,
set up like as your business, right?
well, let me say, look, we will never provide any tax advice, and that's a tax related question.
Right.
And so whenever we get a question about how to characterize income, that's the first thing I say. We cannot provide tax advice. I give them the best answer I can. And look, generally rental income is not earned income generally, but I do know that there might be times whereby it may be earned income. Now, what those times are, I really don't know, and I will never say, because tax laws change on a daily basis, and I don't keep up with it. And look, you're right, but always just make sure you let somebody know who's asking our tax-related question or how to characterize income. They need to reach out to a tax preparer,
Mhm.
because I would never answer a tax question ever again. I don't know enough anymore.
Right. Yeah. That's what I was kind of looking for, was a good answer to
Well,
that
that's-
question. And
That's
I
my
guess
answer.
I guess by me saying yes, I think so sometimes, and yes, I think so
Yeah.
other times, maybe that covered
Hey,
it.
In other words, we don't
indirectly
really
then.
know.
Yeah,
Hey,
right,
it's-
right.
I received a
Which
question, a similar question, Luke. Somebody has a rental income inside an S corporation. And the question was, what's considered to be earned income? So I told this person that the wages out of an S corp is earned income. I do know that. And usually any type of other distribution is not. And I said that also. But I also said that I don't provide tax advice, and if you want an official answer, reach out to your tax preparer, because maybe there are situations whereby if you have a rental properties in an S corp, that maybe more stuff may be earned income. Maybe, I have no clue, but I wasn't going to say yes or no for sure. Okay, Luke,
Yeah.
anything
Sweet.
else?
Nope, that'd be all for me. Thanks.
Okay. Now, Jade, I think you said you're here to listen, or do you have a question?
Oh, no, I'm here to listen, but I did want to just publicly say thank you, Mark, because this past week you really helped me with a question regarding weapon GPO.
Oh, you're
So,
welcome. I
For
don't know
those
if
of you who
Yeah, I don't know.
You
if I
did. I
gave-
mean, it was really great. It just really helped me confirm that everything you guys are teaching
Yeah.
is coming in, and it really
Yeah.
does work. So anyone here that hasn't taken the opportunity to kind of study with y'all or just reach out to you, please do so, because y'all are remarkable and we really appreciate it.
Well, thanks, Jay. I just hope I gave you the right information.
Yeah.
We'll see. Thanks, Jade. I appreciate it. Okay.
Absolutely.
Diana.
I'm here.
Diana will see you. Any questions?
But I'm here. No, I'm actually here learning more myself. This is the first time that I've been on one of these. So I put it in my schedule to make sure that I could tune in and get additional information regarding Social Security.
Okay. Thanks, Diana.
Thank
Appreciate
you.
it.
Thank you.
You're welcome. Allison, you're next, but do you have anything else you want to say?
I don't. Thank
Okay.
you.
Thanks,
This is
Allison.
great.
Greg, you're next. Greg Smith, you want to say anything?
No, I'm like some of the others, absorbing information and
Okay.
just soaking it all in. I appreciate the forum.
Okay. Thanks, Greg. John, you're next.
I'm passing today. Thank you.
Okay. Jeffrey, you're next.
Just listening in today, Mark. Thank you.
Okay. And somebody just left us. Leslie, you're next. Leslie Pickard. Okay. Jim, before we go to Dustin, I received an email. No, phone call today from somebody who's referred to us by their CPA. And this is the question. Her husband just turned age 70 this month, March. He just applied. So she told me his first check will be coming in April. I said yes. But then she said but before she told me that, she told me Social Security sent her a letter saying that she maybe said you might be, or you will be, or you are eligible for a spousal benefit. And then I wondered, why would they send her a letter? But then she told me her husband just filed for benefits in March. So I assume that was kind of why she received the letter. Jim, what would that letter be saying?
Well, that goes back to what we were
Yeah.
talking about in the beginning.
Yep.
When he filed, he listed her as his spouse.
Mhm.
They looked and apparently felt that there may be entitlement to benefits.
Mhm.
So they're just basically telling her that she may be eligible for benefits and to contact Social Security and file an application.
So Jim, they would have looked at her PIA, right?
Yeah, they
Okay.
would have looked at her record, see what her PIA was, and
Okay.
and then closed out the lead by sending the letter. If she responds and files, great. If she doesn't, then she's no longer protected by his application.
And so she's only 63. She can wait until her full retirement age and get the maximum, right?
Yeah,
She
as long
does-
as she's not drawing on her
Yeah,
own.
she's not drawing on her own.
So,
no.
right.
Yeah, she'll be one of our clients down the road. Her name is Michelle. Okay. All right. Thanks, Jim. I wanted to confirm what I told her or what my thinking was. Dustin, you're next.
No questions for me, but
Okay.
thank you for the forum.
Pleasure. Krista?
Great, thanks. I do have just an operational side question. We've been talking a lot about when a spousal benefit might begin, like for example, what you were just discussing, husband turns age 70. Does the wife then, or whoever the spouse is for the spousal benefit, need to actually apply for that spousal benefit, even if she's already applied for her own benefits, or will the spousal benefit automatically occur under the deemed filing rule? Like, I'm just wondering if they have to take an application for that spousal.
Yeah, she's protected under the deemed filing rule, but she will need to file an application. If somebody's applying for retirement and they're eligible for the spousal boost at the same time, the one application will cover it. But if it's different time periods, so you start your own and then down the road you become eligible, then it takes a new application.
Thank you so much for clarifying that.
Yeah. And you can't do that one online, unfortunately. So you have to call Social Security and make an appointment.
Can you do it over the phone or just in person or
It
both?
can be done over the phone. Yeah,
Okay, great. Thank you.
sure.
Thanks. And that brought up another question I received this week. no, not question, a blog I got from SSA that now they're talking about getting replacement or new social security cards. And they indicated in that blog that you can schedule an in-office visit online. I was so excited to see that. I said, well, maybe you can also schedule visits online just to take your application. So I sent that blog onto Jim Blair for his comments, and he said, no, it only applies to receiving social security cards. Jim, am I right there? Are you right?
Well, I'm always right.
Yeah, I know, but yeah.
Don't ask my wife, but
Yeah.
yeah, right now, but it could be that it's the first step.
Yeah.
And they may be seeing how it works, work out the bugs, and
yeah,
and hopefully then somewhere down the road, not too far down the road, folks will be able to apply or schedule the appointment online instead of going through the 800 number.
That would really save a lot of phone calls. And I would think how it would work would be that you log into your online account, and there could be a button, schedule, either an in-office visit or a return phone call. Because even if you want to schedule a return, a phone call, just talking to somebody can take a while. I've heard somebody tell me, they were on the phone for an hour and then they were disconnected. It happened a couple of times. So if you can just go into your online account and schedule a phone call or visit a local office, that would save everybody a whole lot of time. And also it probably might mean that they don't need as many people answering the phones. All right, let's go to John. Hi, John. You raised your hand today.
Yes, I did. I just thought of a question. If I have an issue with a Medicare address. He's got a P.O. box and he's got to change it. I'm assuming that's on the Social Security website. Does that person have to go in, or can they do that online?
Now, if he has an online account, he should be able to change it online through the online account. If he doesn't have the online account, then he'll need to contact Social Security.
Well, yes, contact, but does he have to go in, or can he just call them and make the change from the P.O. box to the actual address?
They should have that address, and they'll just take off the P.O. box. So as long as they can verify his identity, he should be able to do it over the phone.
Okay, perfect. Yeah, because we can't set up an account until he gets his Medicare card.
Oh, okay. Yeah, have him call. And make the change over the phone.
Awesome. Thank you.
Thanks, John. Ethan,
Mark?
Yes, Richard.
Mark?
Yes.
Yeah. Sorry to interrupt. I was having a senior moment. Anyways, the previous question that you and Jim were talking about, I thought you said something about getting a new Social Security card. I got an email supposedly from Social Security, saying about getting a new Medicare card. I thought it was a spam, so I just deleted it. Was that legitimate, or don't you know, Jim?
I wouldn't know without seeing it, but it's probably spam. They don't know that you lost your Medicare card, so
if it's an email, it's spam. But they do send out blogs from SSA.gov. And so if you receive a blog, like I get blogs, I'd say once a week, once every 2 weeks. And so I get a blog comes from SSA.gov, so I know it's legit. And they always have a link back to the SSA.gov website. So I'm talking about a blog, not if it's an email, it's spam. I agree, no doubt.
Yeah, I just didn't know why they would be saying I need a new card. I meant I still have it, No, thank you.
It's spam. They probably want $50 to get you a new card, and okay. Anything else, Richard?
No.
Okay. Ethan, you're up.
Yeah, no questions here. I do have one. We're working with a prospect right now, and they're a little complex with, they adopted their grandchild and kind of working through some of that stuff, and they're both getting pretty close to retirement age. So once we get a full grasp of what their situation is, I'll probably shoot you guys an email.
Okay.
Awesome. Thank you, guys.
My nose itches. Must be allergy time. Elka, you're next. Anything on your mind, Elka? Okay. Before we go to questions that Jim and I may have received, let's do some. Oh, Marcia's up. Well, go ahead, Marcia.
Thanks. I want to just tag on to the disability conversation for a second. I got a call the other day that a child was disabled from childhood. So she's been on SSDI. She's now in her 50s. And they're trying to figure out, oh, she's reaching 65. Sorry, she's reaching 65. And the person said she's only been on Medicaid. And now she needs to apply for parts A and B. And I was surprised by that because as an adult, disabled adult, wouldn't she have been on A and B almost all along? And now she's just moving into Medicare zone. So she needs to get a Medigap or something maybe other than Medicaid. So does anybody have info on disability from a young age all the way through? When does Medicare start for that person?
Well, there's a
It
2-year.
started at 18.
Well, the 2 years starts at 18. After 2 years of the SSDI or the disabled adult child benefits, you're eligible for Medicare. Now, maybe she refused Part B or somebody refused it for her along the road. She still would have Part A, but you do receive a new initial enrollment period at 65. So even if you're on Medicare because of your disability, if you made some bad choices or for instance, if she refused Part B and if you file later on, you're penalized with the new initial enrollment period, she can enroll under that and avoid the penalties. So and maybe they're just telling her that now you're approaching 65. You've got a new initial enrollment period, but if she's already on, so you'd have, I guess, check and see what her situation is, but she should at a minimum have Part A.
Yeah, good. That's what I thought too. Would she have gotten it as a child though?
Yeah, you can get it with,
Okay.
if you're under 18, you're not eligible. At 18, the benefits stop unless you're disabled. And then you've got the 24-month waiting period. So she could have had it since she was age 20.
Mm-hmm. Okay.
If
Thank
they
you.
didn't know about that, do they now get penalized? Like I have some, same thing here, Marcia. I've got people where their kids are in their 20s now, 30, and they're still on Medicaid. If they hadn't been informed, if they didn't realize that they could go to Medicare, would they be penalized at this point, or do they have to wait till they're 65?
Well, they can always sign up. Now, if they're on Medicaid, I mean, the good news is the state should pay the premium for them. So
Right.
They should. I'm surprised that nobody's approached them about that. But, they may be entitled to not know it. I don't know why they would, but I don't know why they wouldn't have received a Medicare card after their waiting period was up. So they need to look into that situation. And if they're on Medicaid, then they need to look into having the state tell Social Security they're going to cover the cost.
Thank you.
And also, if they were on the parents, because they can stay on the parents' group health insurance past age 26 if they were disabled prior to that time. So if they had other credible coverage, then they wouldn't be penalized for not taking the B because the other credible coverage would have covered that B.
Yeah,
and what I don't know is if the Medicaid would be considered other credible coverage. I don't know that answer. Do you guys know that?
I wouldn't know for sure. I don't think it would because Medicaid generally wants them to apply for Medicare because it saves them money. That's why they pay the premium. So I know, for instance, and this sometimes gets people in trouble, but COBRA doesn't count as credible coverage. If you've carried over, you've stopped work and you carried your COBRA over, that's not credible coverage. So I don't think Medicaid would, but I'm just saying that I don't think it would. I'm not saying absolutely.
I just want to mention HIP. the health insurance premium reimbursement. So for those families that kept their kids on their group health insurance, past age 26, they can also apply for HIP. And if their health insurance would have saved Medicaid, Medicaid will reimburse them for the entire family's health insurance premiums. And it could be significant, like 10 grand a year. I mean, whatever they're paying for health insurance. And it's not just for that kid, it's the whole family's premiums. So HIP is something worth checking into for those folks.
Okay. Any other comments on in that situation, folks? Jim, anything else to add?
No.
Okay.
Not that I can think of.
Okay. Thank you, everybody, for chiming in on that. Appreciate it. Okay, Jim, pick two numbers from, two people have left us. 1 to 16. Used to be 1 to 22 or something like that.
Well, okay. Well, let's go with 4 and 10.
Okay, 1, 2, 3, 4. Victoria, you win. So send me an email. Email will be a reminder to get you the $50 gift card. My email address is mkiner, Kiner, at mypremierplan.com. Greg Smith, you win also. So send me an email and I will send you gift cards, both of you.
Ooh.
Jim, you never seem to pick my number.
Well, I try to pick mine, but doesn't seem to work out.
Did you
either.
really? Now, to pick your number, you would have had to pick 7. According to my blocks here.
Yeah, and
All
see,
right.
if, according to mine, I would pick 2.
Oh, really? You're 2 up there? Okay. All right. So, any other questions, folks? Jim, what was the last question you received from a client? Your last 2? Let's talk about the restricted application, of course. Let's talk about receiving a spousal benefit while your benefit grows, earning delayed retirement credits, otherwise up to age 70. Jim, have you received questions like that recently over the last 2 weeks or so?
No, can't recall. I know somebody was asking something about it. I'm not sure when it was. So occasionally we'll get somebody kind of inquires about it. But it's gone pretty much.
Yeah, well,
at this point, even though technically with back pay, somebody could, I'm sure it's not worth it at this point.
Not worth it. And, April 1st is Monday, isn't it, folks?
Yep.
So, once April 1st comes along, then you have 2 months left of 2 months or 1 month, Jim, of being able to do that restricted app and going back 6 months. Is it the end of April or the end of May? I think it's the end of May.
Yeah, I think it's the end of May.
Yeah, so you still, but with each passing month, the advantages of doing the restricted app, you go back 6 months, you get a lump sum check. So of course, we're assuming you're not receiving a benefit, because if you are, the only way to do that is to withdraw your application. If you filed for benefits less than a year ago, you file the Form SS 521 form. And you withdraw your application, you pay back your benefits, then you file the restricted application, you go back 6 months, and then you file for your own benefit effective in December.
But right now, the most you'd get on the spousal would be 3 months, because you can only go back to September. In December, you'd switch over to your own. So
right, it's not much.
Yeah,
and with each passing month in April, it's going to be 2 months. I assume that's what you're saying, Jim.
Yeah.
And in May, it's going to be 1 month. So, yeah. But, yeah, I mean, would I ever do that? Probably not. Withdraw the application, pay the benefits back, do the restricted app effective 6 months ago, and then file you for your own application for effective in December. Yeah, I don't think so.
I guess if somebody's Social Security ticked you off and you wanted to make them mad and make them go through all that work just to give you a month or two's worth of benefits, you could do that. But
not only though, that's kind of a revenge, I guess, or spite, but still it's a lot of work on your part to keep everything straight. It's probably not worth it. And nobody on today's open forum asked about that. So I was really happy to hear that no one asked the question, which I don't like to hear. Okay, Jim, now your last one or two questions you've answered.
We've gotten, oddly enough, a few questions about benefits from foreign countries with the totalization and how that works. First of all, nobody in the local offices would be an expert in that. If someone files for Social Security, they do ask them about working for a job where you didn't pay Social Security tax, which would include working for Canada, UK, Germany, any one of those 28 countries. And if you're eligible for a foreign pension, then totalization may apply. Well, all the local office does is ship that off to Baltimore. They'll process the U.S. Social Security application, send it to Baltimore to see if totalization will apply. And it is possible. The way it works, if you have enough work under each system, then you will draw your U.S. benefit and the pension from the foreign country. Problem is, then your U.S. benefit is subject to windfall. Good news is it's not subject to government pension offset. So if you're going to receive a spousal benefit and you get a pension from a foreign country, GPO doesn't apply. So you won't see that offset. But windfall does if you're eligible on your own. If you're not eligible for a U.S. benefit because you don't have your 40 credits, then the foreign country can take your U.S. earnings and apply that to their benefit, and you may see an increase, or vice versa. If you're eligible for the U.S. and not the didn't have enough work under the foreign pension plan. So we do get some questions on that, and we answer them as best we can. We've got some folks we can refer you to if we need to, if it gets real complicated. So
yeah,
we do have assets available to us should those questions pop up.
As a matter of fact, let me just talk a little bit about that company Jim was referring to. There's a company called Social Security Advisors. I think that's their name. I don't know. Close enough. Located in New York. And they will handle, we send them lots of clients because there's a lot of stuff we just don't care to handle. I don't want to say it mean, but you know, Jim and I were getting a little long in the tooth and we know what we want to do. So when questions come up, Marsha, I'll get you. So when questions come up about totalization agreements, this company will handle that for us. Not really for us, but for the client. And so we're very happy to send that out. A CPA firm sent us a client that had to deal with international stuff, totalization agreements. I sent it to Jim and said, Jim, would you like to handle this? He said, no. And so we sent it to Social Security Advisors. Very happy to do that. Also, when it comes to overpayments, this company out of New York would definitely handle an overpayment question, help somebody, not only just handle the question, but help somebody through the process. You know, we will hold on to clients that we feel that we can really work well with. For example, you know, Social Security consulting and stuff like that. But when it comes to some of this other stuff, you know, there are other companies that are willing to spend more time and are willing to work with those clients. Jim, anything you like to add there?
No, that's pretty much it. There's some, it's just, you know, we've worked with people with overpayments in the past. It's just what little hair I had got either turned gray or I pulled it out. So it's real difficult working with Social Security because even I remember when I worked at Social Security and people would bring in a letter and say, what does this say? And you'd read it and you go, I'll be honest, I don't have a clue what they're telling you. And it would take a lot of investigation to figure it out. So these other folks are a little better at it than we are because I don't know, maybe they have access that we don't, but
they have more patience, Jim.
Yeah, it takes a lot more work than I'm getting lazy.
Go to Marsha. Hi, Marsha, what would you like to add?
Yeah, just on this totalization thing. So if someone qualifies for both U.S. Social Security and a foreign pension, in this case, it's Japan, they would apply for Social Security normal way here. Do they then apply directly through their foreign pension office, or were they also had qualified for a pension?
Yeah, there's in the totalization agreements, there will be an address for them, for the folks they need to contact for that benefit.
Thank you.
Okay, let's talk about the railroad plans, because Jim, I think this past week, I think I received 1 or 2 questions about that, and of course I send it to you. But usually what happens is this: I'll get a question about railroad retirement plan, and my first inclination is just to kind of let them know they need to contact the railroad board. I think they're based out of Chicago, but don't quote me, and they will handle all the filings. Jim, what would you tell somebody that's asking a question about the railroad retirement plan and Social Security together?
Well, basically it's the same thing because they're pretty close in benefits, but railroad has what they call 2 tiers. Tier 1 is pretty much just like Social Security. Tier 2 is an additional tax that they pay to get an additional benefit. And so if you're eligible for both, it's kind of like what we talked about with the totalization. They may combine the benefits into one, or you may get payment from both. And the decision on that is through the railroad board. And their suggestion is always contact the railroad board first before you contact Social Security, because they're the ones in charge of making the decision. And so they'll look at your benefits and they'll tell you whether you need to contact Social Security and apply. A lot of people do get both, but it's just important to go through the railroad board first.
We don't get many questions about railroad, but we do from time to time. How many, Jim, do you think we get per year?
It's hard to say. I do know that when we get one, I know we're going to get 2 or 3 more. Everything seems to come in groups, but I don't know, maybe 6 or 7, less than 10, I would say.
I wonder if those folks out in New York would handle that type of situation. Should
Yeah, they
ask.
might.
His name is Matthew Allen, and his company, I believe, is Social Security Advisors. Anyway, folks, it's close enough to 11 o'clock. So thanks so much.
Mark?
Yes, Richard.
I apologize. I do one last question real quick. Social Security Advisors was one of the software companies I was looking at to do. I was at a blog the other day with other advisors talking about filing the application for a client. And they came to the conclusion because of legal reasons, they advise not doing that. I do know that Social Security Advisors will do that for you. And I'm just curious, Jim, why, is it really that much involved with filing that, you need to be, really knowledgeable about it? Just filling out the application online, basically. And then, so I meant, why the issue of filing for somebody else. If they're getting their own information out the site, you're not doing it, and you can't do it. But can you actually file the application for them legally?
Well, one of the first questions they ask is who's filing the application. Are you applying for yourself or are you a third party? Third parties can act on behalf of people on Social Security. In fact, they just made some enhancements where you can check that online to make sure that everything is up and running. It's a Form 1696. You fill out third party representative. And so in that situation, you could file the application. That requires a paper to be sent to the person for them to actually sign, versus if you file for yourself, there's just at the very end, there's you select my electronic signature and you can take it from there. It doesn't require a wet signature on a piece of paper. The only area that it could really be a problem would be choosing the month of election of benefits, because sometimes there's past due benefits available, the retroactive benefits, or what month in advance do you select? So, when I help somebody file, they are on the call with me, In fact, they are filling it out. I'm just an advisor sitting there answering their questions. And so they're filling it out themselves. And, you know, I guess there's always a potential for a lawsuit, but it should be pretty minimal.
All right, folks, it's time though. 11:01. Thanks everyone for being here, and we'll see you, I guess, in 2 weeks.
See you in a couple of weeks.
Bye.
Bye, everyone.
You.